So one of my children has been on Ritalin, and one of the concerns that was raised to me when he first started on it is that he would potentially not grow as tall if he took this throughout his childhood. He's tall. It was unfounded in our case, but what are some of the adverse effects that we need to consider when these young people are being put on these medications?
Yeah, so with medicines, what we would normally do would be to start at a low dose and see that it's well enough tolerated before gradually increasing the dose to a level that might be helpful. And we're always aiming to get to something that's called the minimum effective dose, and is sometimes trial and error, and sometimes you overshoot and you have to come back. But adverse effects with the ADHD medicines, it's very common for people to have appetite and sleep issues. So 2 or 3 people out of 10, that will be significant. If you're not getting enough calories, it does potentially have an impact on growth. And we used to think that that was transient and people would catch up, but the MTA trial I mentioned earlier suggested that by adulthood, those that were regularly medicated throughout, compared to those who weren't, by adulthood were on average 2.5 centimetres smaller and somewhat lighter. So there can be a growth effect, and boys won't thank you for that. Girls will be a little less concerned about it on the whole, but it still could be a concern if you want to play sport or do other things. So those issues, and then there's a raft of other things. So for the most part, people's mood will be better if they have ADHD. They'll be less reactive, have more time to think, more even with their mood when the medicine's in their system. But about 5 kids out of 100, it really doesn't suit them, and they might become much more reactive, or more highly anxious, or miserable, those sorts of things. And again, those would stop. If you stop the medicine, they go away quite quickly. But it's important to be aware of that. Psychiatrists worry about tics. So tics are repetitive, abrupt movements, blinking, twitching, that you get with Tourette's, and stimulants can uncover those, a tendency to tics, and usually if you stop the medicine they reduce again over time, but just occasionally they don't and you've got a new issue. And then there are things like headaches and tummy aches, which you might get with anything, and we monitor pulse and blood pressure because they can increase, usually not terribly significantly, but can increase in some people. And then atomoxetine, I mentioned a little bit before. The adverse effects are pretty similar, but usually more mild than with stimulants for ADHD. But there's a risk of some other things. So people can get quite sedated and feel quite sleepy, in which case you can give it at night. There's a risk of people's mood becoming elevated, particularly if there's a family history of bipolar disorder. Sometimes people get a bit activated and feel very energetic, and that can be a problem. And there's a very rare chance of liver issues. So that's the ADHD medicines.